We at Janssen at present have two different sorts of capsid assembly modulators that we are currently developing in the clinic. The first of these two capsid assembly modulators is J&J 6379, which is currently in phase 2A drug development. And the second is J&J 0440, which is currently in phase 1B drug development. Both of these two capsid assembly modulators are what we call at Janssen class 1 capsid assembly modulators, which distinguishes itself from the class 2 capsid assembly modulators by their ability to form capsids that are morphologically normal in shape, but devoid of the pregenomic RNA. These capsid assembly modulators bind to the HBV core protein and are able to disrupt both the early and late stage of the viral life cycle. These molecules have a dual mechanism of action. The primary mechanism of action, which occurs much later in the viral life cycle, involves the ability for these compounds to essentially interfere with the capsid assembly kinetics and thereby prevent the encapsulation of pregenomic RNA and the HBV polymerase enzyme. As a result, there's a blocking in the production of HBV DNA and also RNA-containing particles. The secondary mechanism of action for these compounds essentially is the ability for these compounds to essentially inhibit the de novo formation of cccDNA. The ability to trigger this secondary mechanism of action occurs at concentrations that are usually much higher than that required to trigger the primary mechanism of action. Ladies and gentlemen, J&J 6379 in the phase 1B study has demonstrated an ability to not only trigger the primary mechanism of action and inhibit HBV DNA formation, but it has also demonstrated an ability to inhibit the formation of RNA-containing particles. Here I show you an example of a subject who was treated with a low dose of 75 milligrams of J&J 6379 in this phase 1B study. In the graph on the right-hand side, you see in the x-axis you see time in weeks, and in the y-axis you see the reduction from baseline in HBV DNA in red and HBV RNA in green. As you can see, during the 4-week treatment period with J&J 6379, there is a nice reduction in both the DNA and the RNA. Once treatment is discontinued, there is an elevation in both the DNA and RNA again. In this particular subject, approximately 5 weeks after the discontinuation of J&J 6379, the subject was retreated with tenofovir. And here you see again a nice decrease in the HBV DNA, but no decrease in the RNA. This is a good example of how J&J 6379 distinguishes itself from tenofovir, as J&J 6379 is capable of not just reducing HBV DNA, but also the HBV RNA. In an in vitro study, we've also demonstrated that J&J 6379 is also capable of triggering that secondary mechanism of action and inhibiting de novo cccDNA formation. In the images on your right, what you see are two Western blots. The Western blot on the top shows you what happens when you add 5 micromolar of entecavir and 5 micromolar of tenofovir and increasing concentrations of J&J 6379 up to 10 micromolar to a system where the drugs are added at the same time as the hepatitis B virus is added. And as you can see, at the concentrations of entecavir and tenofovir that were tested, there is no inhibition of the cccDNA formation. But at concentrations of 5 micromolars and above of J&J 6379, we see that the formation of cccDNA is inhibited. In the Western blot at the bottom, what you see is the addition of 5 micromolar of tenofovir or 5 micromolar of entecavir, and also increasing concentrations of J&J 6379 up to 10 micromolar. But this time, the drugs are added to the system 5 days after the system was infected with the hepatitis B virus. And as you can see from here, irrespective of the doses of entecavir, tenofovir, or J&J 6379, there is no inhibition in the formation of cccDNA. This in vitro experiment tells us that J&J 6379 is only capable of inhibiting the de novo formation of cccDNA when it is present in the cell before the infection, or at least added to the cell at the same time as when the infection occurs. Ladies and gentlemen, in the J&J 6379 phase 1b study, which was a multiple ascending dose escalating study, we evaluated a number of different doses of J&J 6379. Among the doses that were evaluated was a dose of 25 milligrams that was preceded by a loading dose of 100 milligrams. Then we dose escalated to 75 milligrams, and subsequent to which we dose escalated to a dose of 150 milligrams. All these doses were evaluated in treatment-naive, E-positive and E-negative chronic hepatitis B subjects who were treated for 4 weeks and followed up for approximately 8 weeks after treatment. Now, in this study, the vast majority of the subjects were E-negative. There were 4 subjects who were E-positive in the 25 milligram dose group, and 2 subjects who were E-positive in the 75 milligram dose group. In the higher dose of 150 milligram, there were no E-positive subjects. They were all E-negative. As you can see from the table on your left here, in keeping with the fact that as we dose escalated to higher doses, there were reducing numbers of E-positive subjects, the baseline HBV DNA levels also reduced. In the 25 milligram dose group, the baseline HBV DNA was approximately 6.9 log. In the 75 milligrams, approximately 5.26 logs. And the higher dose of 150 milligram, the baseline HBV DNA was approximately 5.1 log. Now, in the graph on the right, what you see is the change from baseline in HBV DNA following the 4 weeks of treatment. As you can see, all the 3 doses were efficacious compared to the placebo. In the 25 milligram dose group, we saw approximately a 2.16 log drop in HBV DNA. In the 75 milligrams, approximately a 2.89 log drop in HBV DNA. And in the higher dose of 150 milligrams, we saw approximately a 2.7 log drop in HBV DNA after 4 weeks of dosing. Now, we saw a slightly lower log drop in the higher dose of 150 milligrams compared to the intermediate dose of 75 milligrams because the baseline HBV DNA levels in these subjects in the higher dose was slightly lower than that of the intermediate dose, being that they were all E-negatives in the higher dose of 150 milligrams, while in the intermediate dose of 75 milligrams, there were at least 2 subjects who were E-positive. At the end of 4 weeks of dosing, in the intermediate dose of 75 milligrams, we had 2 subjects who had we had 3 subjects who had HBV DNA levels that were below the lower limit of quantification, and in the higher dose of 150 milligrams, we also had 3 subjects with HBV DNA levels that were below the lower limit of quantification. Now, once treatment had been discontinued, subjects in the lower dose of 25 milligrams experienced a relatively rapid rebound of HBV DNA level to close to baseline level within the first 4 weeks after treatment discontinuation. However, subjects in the higher dose of 75 and 150 milligrams experienced a slightly slower HBV DNA rebound. In fact, 4 weeks after the end of treatment, in the 75 milligram dose group, there were 2 out of the 8 subjects who had HBV DNA that was still below the lower limit of quantification, and the higher dose of 150 milligrams, there was 1 out of the 5 available subjects who had HBV DNA that was below the lower limit of quantification. Now, where HBV RNA is concerned, in keeping with the fact that the HBe antigen positive subjects reduced as we dose escalated from 25 to 75 to 150, the baseline HBV RNA also reduced as we escalated to the higher doses. In the 25 milligram dose group, the baseline HBV RNA was approximately 5.59, in the 75 milligrams, approximately 3.39, and the higher dose of 150 milligrams, approximately 3.37. It is also worthwhile mentioning that in the intermediate dose of 75 milligrams, there were 2 subjects who had undetectable RNA at baseline level, and the 150 milligrams, there was 1 subject with undetectable RNA levels at baseline. Nevertheless, after 4 weeks of dosing, we saw substantial declines in HBV RNA across the 3 different doses. In the 25 milligram dose group, we saw approximately a 2.3 log drop. In the 75 milligram, approximately a 1.85 log drop. And the higher dose of 150 milligram, approximately a 1.83 log drop. In addition to this, at the end of the 4 weeks of dosing, 3 subjects in the 25 milligram dosing group at HBV RNA that was undetectable, and there were 6 subjects each in the 75 and 150 milligrams with HBV RNA levels that were undetectable after 4 weeks of dosing. Now, as you might imagine, due to the short treatment duration of approximately 4 weeks, we weren't able to observe any meaningful change in HBs antigen or HBe antigen levels in these subjects. So, ladies and gentlemen, in summary, J&J 6379 has demonstrated itself to be a safe, well-tolerated, and efficacious drug with a dose-proportional pharmacokinetic response. And as such, we have moved this compound into phase 2A drug development. I didn't talk much about J&J 0440 as this is still a compound that's only just entered phase 1B. We have completed the phase 1A SAD-MAD studies, and we'll be presenting this data along with the additional 250 milligram dose data from J&J 6379 at the upcoming AASLD conference in a few days' time. Thank you very much.